Hello and welcome. Today we're diving into something pretty amazing, the tech that lets doctors see what's going on inside our bodies with unbelievable clarity. It's all about making the invisible visible, and honestly, it's the foundation of so much of modern medicine.
So, how do they actually do it? When you look at an X-ray or a CT scan, what you're really seeing is a map of what's dense and what's not. Bone is super dense, right? So it shows up bright white. Easy enough. But what about all the soft stuff? Our organs, blood vessels. That's where it gets a little tricky.
Yeah, without a little bit of help, most of our internal organs just look like a blurry gray blob on a scan. That's because things like your liver, your kidneys, your spleen, they all have very similar densities. So trying to find a tiny tumor or a blockage in that, it's like trying to spot one specific cloud on a really foggy day. Just not going to happen. And this is where our hero of the day comes in, the contrast agent. The easiest way to think about it is like a temporary, super specialized dye that makes certain parts of your body pop for the medical camera. These agents are designed to change, just for a little while, how a specific tissue interacts with the scanner, making it stand out from everything around it. Now, it's not a one-size-fits-all kind of deal. Radiologists have a whole toolbox of these things, and they pretty much fall into three main categories based on what they do to the final image. Each one has a very specific job to do. The basic idea here is actually pretty simple. You've got your positive agents, like iodine and barium. They're dense, they absorb X-rays, and that makes the areas they fill look bright white. Then you have negative agents, like air. They do the exact opposite. X-rays just fly right through them, which creates a dark spot on the image. And finally, neutral agents, like water, are really just used to fill up a space, say your stomach, to give it a clear shape without making it look crazy bright or dark. Okay, so the type of contrast agent you get depends entirely on the kind of scan you're having. Something that works for an X-ray is totally useless for an MRI. Each technology is speaking a different language, and the contrast agent is like the perfect translator for that specific tech. So for any scan that uses X-rays, like a standard X-ray or a CT scan, it's all about density and what's called atomic number. Agents with elements that have a high atomic number, like barium or iodine, are awesome at literally stopping X-ray beams cold. This creates that super sharp white outline that lets doctors see things like your digestive tract or the exact path of a blood vessel. MRI is a whole different ballgame. It doesn't use X-rays at all. It uses giant magnets and radio waves to talk to the water molecules in your body. So its contrast agents, which usually have an element called gadolinium, work by basically changing the magnetic field right around them. This makes the water molecules nearby send out a much stronger signal, creating a way brighter, more detailed picture. And what about ultrasound? Well, that's all about sound waves bouncing off things to create a picture. And for this, we use something that is just so clever: microbubbles. I mean, they are literally tiny gas-filled bubbles that get injected into your bloodstream. Gas is an amazing reflector of sound, so as these little bubbles zip through your blood vessels, they light up like crazy on the screen, letting doctors watch your blood flow in real time. How cool is that? So you can really see how each agent is picked for a specific mission. Iodine is the workhorse for anything with blood vessels. Barium sulfate is the go-to for the GI tract. You either drink it or get it as an enema. Gadolinium is the MRI specialist for finding inflammation or tumors. And those amazing microbubbles give us that live-action movie of our blood flow. Okay, so we've geeked out on the science, but what does this all actually feel like if you're the one getting the scan? What should you expect if your doctor says you need contrast? Let's just walk through it real quick. The whole thing usually follows these 4 steps. First up is prep, which might mean not eating for a few hours. Next, you'll get the agent, either as a drink or through an IV in your arm. Then, after waiting just a little bit for it to get where it needs to go, it's time for the scan itself. And after that, you're done. Your body does all the cleanup, with your kidneys just naturally filtering it out. Now, if you're getting contrast through an IV, I gotta tell you, you might feel some interesting things. A lot of people say they feel a cool sensation going up their arm, and then this really weird, warm flush that kind of spreads through your whole body. Oh, and a metallic taste in your mouth is super common too. It feels strange, for sure, but it is completely normal, and it's usually gone in a minute or two. Of course, anytime you put a substance into your body, you're gonna have questions about safety. And you absolutely should. So let's tackle the biggest concerns people have, and let's separate the facts from the fiction. This is the big one, right? And the short answer is that for almost everybody, these agents are incredibly safe. The ones we use today have been studied and refined for decades to work really well with very little risk. But let's get into the specifics. Okay, let's just clear this one up right now, because it's probably the biggest myth out there. The idea that if you're allergic to shellfish, you can't get iodine contrast is completely false. They are not related. The thing in shellfish that causes an allergy is a muscle protein. Iodine is just an element on the periodic table. Your body actually needs it to function. There is zero scientific link between the two. So what are the real but very small risks? Well, a tiny number of people might have an allergic-like reaction, usually something mild like hives. That's why it's so important to tell your doctor if you have bad asthma or if you've ever had a reaction before. The other thing is kidney function. Since your kidneys are what filters the agent out, your medical team will always make sure your kidneys are healthy enough for the job before they even start. And speaking of kidneys, here's a number that should make you feel pretty good. The current science tells us that for patients with a kidney function score, it's called an eGFR, of 45 or higher, the risk of the contrast causing any kind of kidney injury is basically zero. It just goes to show how seriously the safety protocols are taken. And really, that's what this all comes down to. These incredible substances give doctors a kind of superpower, the ability to see deep inside us with amazing detail. They turn what might have been a fuzzy guess into a clear, confident diagnosis. And that helps guide treatments and truly save lives every single day. So, it really makes you think about what's next. We've gone from blurry black and white images to watching blood flow in real time. The next big thing is probably smart contrast agents. Imagine nanoparticles that are designed to only stick to cancer cells, lighting them up like a Christmas tree for doctors. As our tools get sharper and smarter, you have to wonder, what other invisible secrets is the human body just waiting to show us? Thanks for tuning in.